Hello everyone, I am Dr. Lokesh Handa, Senior Plastic Surgeon practicing in Greater Kailash, South Delhi. Today I will be talking about the medical management on the hair loss. So what causes hair loss? One of the most common causes of the hair losses are androgenetic alopecia, which means that the hair loss is happening because of the genetic influences as well as the hormonal influences, and this usually happens in the male population. It can happen in females also, but the female pattern hair losses, they are different compared to the male pattern hair losses. In males, more than 90% of the hair loss is androgenetic alopecia, while in females there are a lot of causes, out of which there could be PCOS, there could be lifestyle related issues, hormonal issues, the deficiencies in the hormones or the nutrition. So a lot of causes can be there in the females which we need to evaluate compared to the males. And in males also there are other medical causes, medical conditions which can lead to the hair losses. Talking about the medical management, one should always seek the help of the expert while managing for the hair losses. And when we are talking of medical management, there are basically three things which will help in the treatment of the hair loss. First is the use of the topical serums or lotions. We are talking of the topical. Topical means that the lotions which have to be applied on the scalp. So there are the most common one which we use is minoxidil lotion. It has been FDA approved, and it is the most commonly used drug for the hair loss. There are other serums and lotions which can be used, like the role of Anagen, Capexil, Redensil in various concentrations and in various mixtures. They can be used for the hair growth. Second is the role of the oral medications. In the oral medications, multivitamins play a major role. Along with that, in the male population, the role of anti-androgens, which is most commonly used, is the finasteride tablet. So these tablets are used. These can be used in female hair loss also, but then we have to evaluate whether the female hair loss is because of the androgens. Androgens are basically the male hormones. And the third and one of the most commonly used medical management for the hair loss, which is the injectables, it is the PRP. PRP means the platelet rich plasma. Platelet rich plasma, it is derived from your own blood. So we centrifuge the blood. Centrifuge means we spin the blood in the test tube, and then we obtain the plasma out of that blood. And in the plasma there are platelets which are concentrated. So these platelets, they contain growth factors, and these growth factors, they help in the growth of the hairs. The PRP is injected into the scalp in the area where the hair loss is happening, and this treatment is usually done once in a month, and for the first 3 to 6 months it has to be done continuously if you are experiencing a lot of hair fall. And after that it can be done as a maintenance treatment, where you can do it every 3 months or every 6 months for the maintenance. There is other also treatments like GFC, which is growth factor concentrate. It is also made in a similar way the PRP is done, but it is a little bit advanced form. So it also arrests the hair loss, and it is very useful for the treatment of hair losses. The other injectable treatments which are used, it is known as mesotherapy. Basically, mesotherapy means that any drug which can be injected into the scalp. These drugs, these can be minoxidil, some vitamins, or some growth factors which are synthetically made. So these can be directly injected without the use of your own blood, and these are available in the market, and they can be obtained and directly injected. So the overall time duration of the treatment is less compared to the PRPs. So these in brief are the medical management treatments for the hair loss. Thank you.